Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the extra-articular manifestations of rheumatoid arthritis? Extra-articular manifestations of rheumatoid arthritis are: we have rheumatoid vasculitis. Rheumatoid vasculitis can cause polyneuropathy. It can cause mononeuritis multiplex, or it can be associated with digital gangrene, or myocardial infarction can be seen in rheumatoid vasculitis. Then there is also pleuropulmonary manifestations are also common in rheumatoid arthritis. These pleuropulmonary manifestations include pleuritis. The patient can have pleural effusion. The pleural effusion in rheumatoid arthritis is more commonly seen on the left side, and here there is low pleural fluid sugar will be seen. With in pleural effusion there is low pleural fluid sugar with clear aspirate is seen, and there are no pus cells. And in pleuropulmonary manifestation there is Kaplan's syndrome is also seen. In Kaplan syndrome there is presence of pneumoconiosis is present with rheumatoid arthritis, with lung nodules are important in Kaplan's syndrome. And there is also pericarditis is seen. This pericarditis is usually asymptomatic. Pericarditis due to rheumatoid arthritis is asymptomatic, and even the patient can develop chronic constrictive pericarditis may also occur in the patient. Okay, the patient may also develop restrictive cardiomyopathy can be developed in the patient. Then if you see the mitral valve regurgitation, mitral valve regurgitation is the most common valvular abnormality which is present in the rheumatoid arthritis. Then actually cardiovascular complications are the most common causes of death in rheumatoid arthritis, whereas the second most common cause of death in rheumatoid arthritis is actually infection. Then neurological symptoms of rheumatoid arthritis. In extra-articular manifestations, the patient can have peripheral neuropathy can be seen mainly due to vasculitis. The patient can have cord compression can be seen due to atlantoaxial subluxation. Atlantoaxial subluxation can result in cord compression. There can be nerve entrapment may be seen. This nerve entrapment is mainly because of the proliferative or synovitis can result in nerve entrapment. Okay, even nerve entrapment, like there can be the patient can develop carpal tunnel syndrome. This carpal tunnel syndrome is mainly because of the medial nerve compression can cause carpal tunnel syndrome. The patient can also develop tarsal tunnel syndrome. Okay, this tarsal tunnel syndrome can be due to the posterior, it can be due to posterior tibial nerve tarsal tunnel syndrome. Then the manifestations in the eye, if you see in the eye, the rheumatoid arthritis can develop as episcleritis. It can form scleritis, or it can occur, it can form it can cause conjunctivitis. It can also cause scleromalacia, rupture of the globe can occur in the eye. Most important is uveitis is not a feature of our rheumatoid arthritis. Uveitis is a feature of, but uveitis is a feature of juvenile rheumatoid arthritis, not the normal rheumatoid arthritis. Then we have rheumatoid arthritis is associated with Felty syndrome. What is Felty's syndrome? Felty's syndrome is rheumatoid arthritis with splenomegaly with neutropenia is called as Felty's syndrome, which is associated with rheumatoid arthritis. Then manifestations in the skin. In the skin, it can cause vasculitis, and in some cases, it can also cause skin necrosis. It can result in malignant rheumatoid arthritis, and it can cause nodules which are called as rheumatoid nodules are seen in almost 20 to 30% of cases have rheumatoid nodules. Then we can see Sjogren syndrome. Sjogren syndrome is also seen. Actually, if you see the Sjogren syndrome, in this actually rheumatoid arthritis is the most common cause of secondary Sjogren syndrome. That is Sjogren syndrome which occurs due to some other diseases. So secondary Sjogren syndrome, here the most common cause of secondary Sjogren syndrome is rheumatoid arthritis. Then manifestations in the blood. Right. In the blood, rheumatoid arthritis causes anemia of chronic disease. It can also cause anemia of chronic disease is a type of normocytic normochromic anemia. It is a type of normocytic normochromic anemia. Some people may also develop diffuse large cell lymphoma may be developed in the patient. The patient may develop diffuse large cell lymphoma. The patient can also have fever, and the manifestations of rheumatoid arthritis, if you see in the kidney, the rheumatoid arthritis will develop as membranous glomerulo. It can develop as membranous glomerulopathy, interstitial nephritis, and it is mainly due to the NSAIDs. It occurs due to NSAIDs. In the kidneys, the patient might develop membranous glomerulopathy, interstitial nephritis due to NSAIDs. Then, in amyloidosis, the patient can present as nephrotic syndrome, and so if you see, actually this is a complication. So if you were asked what is the complications of rheumatoid arthritis, one, the patient can develop amyloidosis which can present as nephrotic syndrome. The patient can also develop septic arthritis due to rheumatic arthritis, and this septic arthritis is usually caused by Staphylococcus aureus will result in this septic arthritis.
Thank you and thank you for watching.